And now I'd like to introduce Dr. Bill Kim, our Chief Medical Advisor for Beach Cities Health District. So what he's going to do is just give a brief state of COVID-19, where we are. He will go into a little bit about testing, a little bit about vaccine trials, some of the guidance, a lot of probably what you've heard today. And since we have a small group, I would say if you have a question, go ahead and put it in the chat or raise your hand. If there's something specific you'd like to talk about, and he can address it during the presentation. We do have an hour, so we will have time at the end if you want to hold your question as well. And then if we get off track, I'll help us keep us on time here. But with that, I'll turn it over to Dr. Kim.
And how COVID-19 is affecting LA County and the beach cities. Kristen, do you have control of the screen to do the slides?
Yes, so when you're ready, you can just say next and I'll switch.
All right, why don't we go to the next slide then? So these are the numbers at a glance in the South Bay as well as in LA County. You can see as of yesterday, we had about 274,000 cases and about 6,600 deaths. In the beach cities, we've had a total of 1,167 cases. They're spread out with Hermosa having the last at 224. Manhattan Beach has been 372, and Redondo was 571. We've had a total of 20 deaths in the South Bay, 11 in Redondo, 5 in Manhattan, and 4 in Hermosa Beach. The graphs below those numbers, those statistics, are the average daily new cases. This is a 7-day average. And the take-home message from there, and we'll see this throughout some of our data, is that we had a pretty big spike after the Memorial Day. That was in July, and then after July 4th. And now it's trending down nicely. And so far it's early on, but the trend after Labor Day appears to be stable, which is a good thing. In marked distinction to what's going on around the world, those of you that are following statistics, I think England yesterday had their highest daily positive rate so far. And anyway, the average daily reported deaths are trending down, and that's very nice. Now we're really today below 20, which is nice. Next slide, please, Kristen. So this is the LA County COVID hospitalizations, and these are 3-day average numbers. Once again, it exemplifies that spike we saw after our first holiday this year and also the July 4th holiday. And the numbers are so pleasing to see. Even though our positivity rate is dropping, the amount of people being hospitalized, the elderly and infirm, are much less. So we're seeing a really nice trend. Next slide, please. This is one of my favorite slides, and it really looks at the cumulative cases per 100,000 individuals. We're focusing on the South Bay, which are the bottom 5 numbers, but it compares to LA County as well. So that black line you see at the top is LA County. Below that is Inglewood, and below that, the yellow line, Hawthorne. Now our beach cities, which we're including El Segundo down at the bottom, have done quite well. The Hermosa Beach cumulative case per 100,000 is the green line. This is followed by Manhattan Beach. The gray line is Torrance. Redondo's blue, and El Segundo is purple. So kudos to the South Bay for following the recommendations, because I think that's one of the reasons why our cumulative cases are down compared to LA County. Next slide, please. This is also an interesting slide by month. And so once again, it exemplifies how we started early in March with the first, when the pandemic was just kicking in, getting into April, excuse me for the frog, but Redondo had its little spike, and some of that was nursing homes. Then we did quite well until, once again, the Memorial Day and July 4th holiday. Once again, we see the trends coming down, and this is a good finding. Next slide, please. These are, some of you have been following probably the California blueprint to open up the state for a safer economy. The experts on the state level have divided risk level by county, by a widespread risk, substantial risk, moderate, and then minimal. And how those different risk levels are defined are on two metrics. One are new cases per 100,000, and then the positive test rate. So the new cases per 100,000, when they're more than 7, then it's wide risk. Right now, we're still there, but we are, in LA County, we are vacillating between widespread and substantial. And because of that, you've seen in the news, certain things are being offered up, such as TK through second grade classes with a waiver can open. We'll talk a little bit about that in a little bit further. The positivity, the test positivity rate doesn't really mirror the new case rate. And we'll see that when we go over our exact numbers coming up. But all that's important on opening up a safer economy in California. So on the next slide, we'll see that what some of the retail, school, restaurant, and gym examples are to allow us to open up. And as I mentioned, LA County is still in the widespread area with some substantial risk. So certain things are starting to open. For instance, gyms, it's going to be a while till we can actually allow indoor gym modification because of our current infectivity rate. Schools, very interesting in that it's closed for in-person instruction, except now KT through second grade are allowed on a limited basis, 12 students per class with 2 instructors, and you have to have a waiver to do that. I think we'll go to the next slide, please. This is the California blueprint for safety where the counties lie at the present time. LA County is at 7.3 cases per 100,000, but the positivity rates dropped nice. It's below 3, which would put us into the moderate range. But because of the cases per 100,000s are still in the substantial range and even a little bit higher, that's why we're not allowed to open up with impunity, and we're just doing it on a piecemeal basis. So who's at risk for severe illness? I think most of you know this, but it's mainly us older adults, and I'm in that population, believe it or not. When we look at the deaths in LA County, 92% of those that have died have had underlying health problems. That's such as hypertension and diabetes. Also, strokes, neurologic problems, cardiovascular disease, and chronic renal disease are common in those individuals. And we're not going to touch on it on this lecture, but it's also spread across the board by ethnicity, with our Hispanic population suffering much more than some of the other ethnic groups. Next slide, please. So transmission. We know that respiratory droplets are involved with the transmission of the COVID-19 virus. Respiratory droplets are produced when an infected person coughs or sneezes, speaks loudly, or sings. These droplets are spread by the force of the exhaled material, and they can be picked up by us breathing them in, landing on a surface and touching our nose or our eyes, inhaled into our lungs. It's much more likely to get a dose that's infective if you're within 6 feet of an individual, and particularly if they don't have a mask on. There is some concern about, some of you might have read about aerosolization. That is much more infective, so to speak. So there is some thought that in closed environments that you don't really have to be right next to somebody or within 6 feet and still get enough virus to become infected. That's why really a lot of our social distancing is suggesting that we stay in open spaces, not in closed spaces. Kristen, may we have the next slide, please? Well, you all know this, but we can't say it enough. And this is now an international recommendation that we wash our hands frequently, You avoid touching your eyes, nose, mouth with unwashed hands. If you're feeling sick, if you feel a little scratchy throat, like you might be coming down with a cold, stay home. And then practice physical distancing, especially when you're by staying at home. And those of us that are over 65, that's real important. If you do go out, wear a clean face covering, whether it be a mask or cloth face covering. There are some recommendations on how to clean these. They really should be cleaned on a daily basis, at least the cloth face coverings. And if you have non-medical grade masks or medical grade masks, those should be changed out frequently as well. Flu. Well, the flu is upon us. The flu season is upon us. And here at Beach Cities, we say boo to the flu. And to do that, the best thing is to vaccinate. So everybody that's 6 months of age or older should get a flu shot with rare exceptions. And why get a flu shot? Well, it's extremely safe. The flu vaccine's been around for quite a while. It's a killed vaccine. Some individuals say, oh, you know, I got the flu shot and then I got sick. Well, it could be that they had a prior exposure to one of the components of that vaccine and had a robust immune response, leaving them feeling a little achy. And that is a simple, I mean, it's not a very big price to pay to protect yourself from getting one of the flu strains that are going to come this year. By getting a flu shot, it protects yourself from others who won't do as well. Those that really need to get a flu shot or should prioritize it are young children. Those are under the age of 2 and over the age of 6. Those kids sometimes don't do so well when they get the flu. Pregnant women, those of us 65 of age and older, and then those with chronic medical conditions, you know, like diabetes, heart failure, COPD, and asthma. Next slide. We can all be health leaders. This is a cool slide. Look at these kids with their masks on. So they are helping us, and a good example. How about COVID-19 testing? And then we'll get into vaccines. For testing, I don't want to bore you. Some of you probably know this, but there are 2 kinds of tests that we're currently doing. One is the diagnostic test, which is a nasal swab or PCR test. We take a Q-tip, and we used to shove it back to the tragus or the anterior portion of the ear through the nose, but the newer tests aren't quite so uncomfortable. It's a simple swab that's swabbed in each nostril. That's the test we're using at our site for about 10 seconds. That test is testing for the actual virus or the RNA from that virus, and if positive, would say that you have an active infection. The other tests are called serologic tests or antibody tests. When one gets an infection, there's an immune response that's generated. It starts with the IgM antibody, which is an early phase antibody that helps neutralize the virus that we're trying to fight. And then the IgG antibody kicks in, and this starts at around 5 to 7 days and then peaks at 2 to 3 weeks. And in certain infections can offer lifelong immunity. That is the IgG antibody. If we test for that and you have positive antibodies, that means you've had an infection. Either you knew it or you didn't, but either way, you are immune, at least at the present time, from catching the virus. As I say, we're not sure how long the coronavirus immunity will last, but we hope that it'll be a long time. So vaccine trials. Well, as you probably know, there is no vaccine that's currently available. I've been following this very carefully, and I just wanted to say, as of in August, when I looked at it quite carefully, there were 231 vaccine candidates in development around the world. 6 of those are now in phase 3 clinical trial. 4 of those are available for phase 3 clinical trials in the United States. In Southern California, the Kaiser Permanente health system is offering a test site. The Lundquist Institute, which is over at UCLA at Harvard General, is working with the Oxford and the AstraZeneca vaccine, which is an interesting vaccine. That vaccine uses the adenovirus, which is a cold virus that infects chimpanzees. So it's a very mild virus. And then they've taken the spike protein and introduced that onto that virus. The spike protein is the protein on the coronavirus that binds to our ACE inhibitors and allows the virus to get into our cells and wreak havoc. So that's a really cool vaccine. Anyway, if you're interested in participating in vaccine trials, you can visit beachcitieshealthdistrict.org COVID testing for more information, or go to the LA County Department of Public Health, who are releasing guidance for those interested in the vaccines. So at Beach Cities Health District, our little testing center, so proud of it. In April 3rd, we opened up that test center at the Galleria, the South Bay Galleria. Since then, we've moved it down to our site at the old campus, the old hospital campus at 514 North Prospect. We have probably done the better part of 60,000 cases after this weekend. It's a drive-through. Appointments are preferred or required. Now, who can get a test there? Well, anybody with symptoms consistent with COVID-19 can get a test at any of the sites. Any person that's been in close contact in the past 14 days with someone known to be infected with COVID-19 should be tested. And then those that live or work in high congregate settings, such as a homeless shelter or nursing homes, should also be tested. There are a limited number of tests available for what we call asymptomatic essential workers. So we like our police and fire department to get tested. Individuals that are working in the public that have frequent contact with others in the public, like I would say some of our grocery checkers are able to get tested. If you should want to get tested, we suggest that you first check with your primary provider, your primary physician. He or she might have a preferred place to send you. But if they don't have, they aren't able to offer that, then please visit the covid19.la.gov/testing website, and you'll be referred to an area where you can make an appointment. This is a good slide in that there's a little bit of confusion over isolation and quarantine. So what is isolation? Well, isolation is when you have the virus, and then you should isolate yourself for 10 days. And that's from when your symptoms first appeared or when you had a positive test. And that isolation should continue until the 10 days is over, or you've had 24 hours of complete asymptomatic, no symptoms, and that you're not taking any Tylenol or Advil to make yourself feel better or to keep the fever down. Most of these COVID-19 cases that are cared for at home are resolved within 10 days. The individuals that are going to get more ill, it's usually on day 5 to 7, and then by day 10, you're in the hospital. So these are for those that are getting over it easily. Quarantine is different, and it seems a little more difficult than the isolation. So quarantine is for anybody who was in contact with someone, whether they're asymptomatic or symptomatic, with COVID-19, and those individuals should quarantine themselves for 14 days. That is because the incubation period for this virus is thought to be about 14 days. A study showed that 10,000 individuals were looked at. 90% plus were symptomatic within 5.2 days. But on day 14, still 101 developed symptoms on day 14 or after. So we can't have everybody staying in forever. So 14 days was the time limit that's provided for quarantine. Close contact means within 6 feet of an individual for 15 minutes or longer, or unprotected direct contact with respiratory secretions. So you're at a grocery store, somebody coughs and sneezes behind you. You don't really know whether they have COVID-19, though I think with contact testing, in some countries there's a cell phone. In fact, it's available here too. I'm just not sure how much that's taking off. You could be contacted by the local authorities saying that somebody was with COVID was around you. That's by following your location. It's being used in England quite effectively, but I think here we're having a little bit of pushback because of individuals that are concerned about Big Brother watching us, so to speak, kind of knowing where we've been because of our cell phone. Now, if you even have a test negative for COVID-19, so let's say you've been exposed to somebody, you go ahead and get a test, the test is negative, you should still stay quarantined for 14 days because that test could turn positive 2 days later. Let's do the next slide. Thank you. Well, at Beach City's Health District, I'm proud to say we have lots of programs. We're there to assist and inform individuals and to give referrals. We have a wonderful team that's always around. We can help with errands, answer health-related questions, give referrals if needed, deliver meals, assist in so many different ways. Now, our referral line is 310-374-3426, and then you hit extension 256. This is now operated Monday through Friday from 8:30 in the morning to 5 in the afternoon. Next slide, please. Oh, we've done there. Oh, Safe in the South Bay. This is a cool program that's been developed by Beach City's Health District in collaboration with the city leaders, city governments, and chambers of commerce in the beach cities. So we put together a little program where industries and businesses can follow our instructions and then sign up to be a Safe in the South Bay participant. And we hope that those businesses and industries that want to do this, it's going to help keep the South Bay safe. Let's see what's on the next slide. I think there's something that explains it a little better. Oh no, well, we're going to get into recovery and opening. So with respect to, there's new sectors, yeah, recovery and opening. So for residents, we suggest that you follow the local health guidance, which is available online. Basically, it's avoiding large crowds. Got to wear a face covering if you're outside your home. Avoid touching your face and wash your hands, and stay at home if you're sick. For businesses, they can go to the reopening guidance that you can find at beachcitieshealthdistrict.org, and these are all following the LA County Department of Public Health guidance suggestions. We suggest that if at all possible, allow people to continue to work from home or telework if it makes good sense. And when we finally get back to more opening, we want individuals to know that their experiences are going to look a lot different. Spaces and restaurants and workplaces are going to be much different, many times with partitions. It's going to be a different environment, but we'll get used to it. So the new sectors that are reopening, this in the last week or so, I just mentioned it earlier when we were talking about the California Blueprint for a Safer Economy. Well, as of last week, nail salons can open indoor, but only servicing about 25% of their capacity. They can still do outdoor services. I mentioned the TK through second grade. This is by application only. They're only going to allow 30 schools per week. This is starting today, and the schools that are allowed to do this will only be allowed 12 children with 2 instructors. They have to stay as a single unit or a social bubble for the entire time. Anyway, I think that's important for our young ones. It seems it's very difficult for them to be doing Zoom classes, so I'm glad to see this happen. Card rooms are now open as of today as well, but it's mainly outdoors. You can't have food or beverages. Indoor shopping malls will be on Wednesday. Occupation 25%, capacity only, and common areas, including the food courts, are not allowed to open. And last week, at the discretion of local cities, playgrounds are allowed to open, but with face coverings and physical distancing required. Let's have the next slide. Oh, this is more about our so proud of Safe in the South Bay. So we have a protocol online. If anybody's interested in this or has an industry or a business that you're interested in joining, you go onto our website, complete the protocol, take the pledge, and then post the seal in your window. And I'd love to see this. I know all of us at Beach Cities would like to see this on every business in the South Bay, to kind of show community compliance and camaraderie. These are just some examples of what some of our local industries have done to open up the restaurants to outdoor dining. A couple of the restaurants I've seen, I haven't been to any yet, but I see also partitions between the tables that are 6 feet apart, plastic partitions. And of course, you'll see your servers with face shields as well as masks and gloves. So resources, there's lots of resources. So for businesses, restaurants with questions regarding enforcement and to report violations and compliance issues, the LA County Department of Public Health Environmental Health Hotline is 888-700-9995. For those industries that see there are more than 3 cases, an outbreak of 3 cases or more, it's required to report this to the LA County hotline at 888-397-3993. And then for non-business related questions, anything about the coronavirus and public health, the Los Angeles County Public Health Coronavirus Information Hotline is the 877-777-5799. At our website, we have a plethora, tons of virtual programming. We have programs that are like, anyway, you can download these programs and participate for kids, adults, and then there's so many different helpful programming programs that you can look at. Covers almost anything you could think about with regards to COVID-19, and also just staying healthy, diet. I don't know, Kristen, can you remember how many programs there are? I know
we have more than, I think, 200 videos posted right now since March. So there's a lot of information and opportunity out there for folks.
And Cindy mentioned how many hits we've had, so to speak. There's 20 or 30,000 just off the top of my head. So a lot of people are enjoying these services.